The night shift at the nursing home always felt longer than it looked on the schedule. On paper, it was just 11 to 7. 8 hours. Routine. Meds at midnight, rounds at 2 and 4, charting in between. But somewhere past 3 a.m., the building stopped feeling like a workplace and started feeling like a place where time got stuck and refused to move. Jenna had only been there 6 months. Long enough to know the smell that never washed out of her scrubs. Long enough to memorize which residents would ask for water right after lights out, which would try to get out of bed without calling, which would wake up screaming from dreams they couldn't explain. Long enough to understand that the day shift and the night shift lived in 2 completely different versions of the same building. The East Wing, where she worked, was supposed to be the quiet side. That's how they'd sold it to her. Long-term, mostly non-ambulatory, lots of dementia, the nurse manager had said. Not a lot of drama. Nights are mostly keeping everyone dry, turned, and alive. That last part had sounded like a joke at the time. It didn't anymore. On this particular night, the air in the East Wing felt heavier than usual. The humidity in the building was up, the old air conditioner struggling, the windows long since sealed shut. The overhead fluorescent lights in the hallway buzzed faintly every time she walked under them. Evening report had been the usual blur of information: weights, wounds, meds, behaviors. The day nurse rattled off the details like an auctioneer who'd been doing this too long. 101's daughter complained about the food again. 104 refused her Lasix. 109 fell last night. Keep an eye out. 112's family brought in their own snacks. Label anything you open. And 118, she stopped on that one. What about 118? Jenna asked, pen hovering over the sheet. The evening nurse glanced down the hallway, then back at the chart. Mr. Hargrove, she said. 86. Full code. Lungs shot, kidneys not far behind. Used to be a nurse, if you can believe it. That one's different. Different how? Jenna asked. He watches, the other nurse said. That's what creeps people out. Most of them stare at the TV or the ceiling. He watches the hall, watches the staff, and he has this habit of commenting. Commenting? The nurse closed the chart with a soft snap. You'll see, she said. It was a little after midnight when Jenna went into 118 for the first time. The room was dim, lit only by a weak lamp on the dresser and the slice of hallway light coming through the half-open door. The blinds were shut. The air held that layered smell of old linens, lotion, and something deeper that never quite left no matter how often housekeeping came through. Mr. Hargrove was awake. He lay propped up on 2 pillows, a thin frame swallowed by the mattress, eyes clear and too alert for someone his age at this hour. His hair was white and sparse, his skin a map of old bruises and fresh purple marks. Oxygen tubing looped under his nose, connected to a concentrator humming steadily beside the bed. He wasn't looking at the TV. It was off. He was looking at the hallway. Jenna paused in the doorway, then stepped inside. Hi, Mr. Hargrove, she said quietly. My name's Jenna. I'm your nurse tonight. He turned his head toward her, slowly, like he'd known she was there before she spoke. Night shift, he said. His voice was rough but steady. New. She smiled a little. Still learning everyone, she said. How are you feeling tonight? He lifted one bony shoulder in a half shrug. Same as yesterday, he said. More tired, more done. But they don't write that in the chart. She moved into her assessment almost automatically. Blood pressure, pulse, respirations, lungsons, edema. His body had the look of something that had been close to the edge for a long time without completely going over. They told me you used to be a nurse, she said, trying to make small talk. His eyes flicked to her, the faintest hint of amusement there. A long time ago, he said, back when men on the floor made people assume you were a doctor. I liked being the one at the bedside instead. Why? She asked. He looked back toward the hall. I liked watching, he said. Vital signs, trends, patterns. Who gets better? Who doesn't? Who just wants attention? Who's actually dying? It's all there if you know how to see it. Jenna glanced at the portable monitor beside him. His blood pressure was low, but not crashing. His oxygen saturation hovered in the high 80s, better than some of her other residents. His heart rate was irregular, but not wildly so. "You think you're dying?" she asked. She wouldn't have asked that to most residents. But he seemed like the kind of man who preferred bluntness over sugarcoating. "Everyone in this building is dying," he said calmly. "Some of us are just a little further along the curve." He didn't say it sadly. He said it like he was reading lab values off a screen. He watched her hands as she adjusted his oxygen, checked his heels, straightened his sheets. Not in a suspicious way, more like he was assessing her technique, grading her without telling her the score. "You've already had one fall tonight," he said suddenly, as she was noting his lung sounds. She looked up. "What?" "Room 109, he said. "She grabbed the rail wrong when you turned her. You're worried about the bruise on her hip. You'll check it again later, even if you don't write it that way." Jenna froze. "How did you—" "I heard it," he said. "Heard the crash, heard you apologize, heard her say she was fine even though she wasn't. Heard you walk past this door faster than usual afterward." There was no accusation in his tone, just observation. She swallowed. "Are you sleeping at all?" she asked, steering away. "Getting any rest?" "Not much," he said. "Things happen here at night that don't happen during the day. Would be a shame to miss them." "Like what?" she asked. Part of her expected him to say ghosts, shadows, dead relatives at the foot of the bed, the usual night shift stories. He didn't. "Like who doesn't make it to breakfast," he said. She finished her documentation at the bedside, recording his orientation, person, place, time, situation. Intact. No chest pain. No acute shortness of breath beyond his usual. No complaints other than tired. She made a light joke about him needing to give the night shift a chance before judging it. He watched her walk to the door. "You'll lose one before the week is out," he said conversationally. She stopped. "What?" "One of mine," he said. "East Wing. Before your next weekend off. You can feel it starting already if you listen." "Mr. Hargrove, that's not funny," she said. "It isn't a joke," he replied. "It's just pattern recognition." She stepped back into the hallway with a chill running up her spine. Residents died here. That was the unspoken core of the job. You got to know them, learned how they took their pills, met their families. And then one day the bed was empty and stripped, waiting for the next name on the admission list. But hearing it laid out like a schedule with that quiet certainty made something in her recoil. She told herself he was just a morbid old man who'd worked in hospitals too long. 2 nights later, when one of her residents died at 4:30 a.m., she remembered his words anyway. The first death came quietly. Mrs. Vaughn in 104 slipped away just before dawn 2 nights later. End-stage heart failure, DNR, family already prepared. On paper, it was peaceful and expected. At the nurse's station, Jenna signed the death note with the usual detached focus. Time of death, who was present, who was notified, routine. It wasn't until she walked past 118 on her way back down the hall that the routine cracked. Mr. Hargrove was awake, eyes fixed on the ceiling. As she passed, he turned his head just enough to see her. "1," he said softly. Jenna stopped in the doorway. "What?" "You'll lose one before the week is out," he reminded her. "That makes one." His tone wasn't smug. It was almost tired. She felt a chill, then forced herself to move on. People died here. That didn't make him psychic. It made him realistic. That's what she told herself. Over the next few shifts, she tried to avoid lingering in his room. She still did all the checks, vitals, skin, meds, repositioning, but she kept the conversation surface level. Weather, food, how annoying the TV remote was. He had other plans. "Keep an eye on 102, he murmured one night as she adjusted his blankets. "She's further along than they think." "Her labs are stable," Jenna said automatically. "Doctor says she's holding." "Doctor sees numbers," he replied. "I see the way it takes her 3 breaths to finish a sentence. Her body's already arguing with itself." Another night, as Jenna passed 110, He spoke up before she even reached his door. "You smell that?" he asked. She paused. "Smell what?" "Sweet," he said. "Heavy. That's kidneys failing. She won't need that dialysis referral for long." "Have you even seen her chart?" Jenna asked. He gave her a look. "I don't need the chart," he said. "They roll them past my door. I hear their coughs. I hear how often the bathroom door opens. I hear how you talk to them going in, and how you talk to them coming out after you've seen the latest labs." It was true. His room sat near the center of the wing. Everything passed him sooner or later: beds, carts, family, gossip. He was like a vital sign monitor for the whole corridor, listening instead of beeping. The second death came 4 days later. Mrs. Price in 102. She wasn't on anyone's radar as active yet. Confused, yes. Weak, yes. But the assumption was that she'd linger like that for weeks, maybe months. At 2:15 a.m., Jenna found her slumped in bed, eyes half open, breathing so shallow it barely moved the sheet. By 2:20, she wasn't breathing at all. The on-call provider called it sudden but not surprising. Family said, at least she didn't suffer long. The day nurse said, honestly, I thought 110 would go first. When Jenna passed 118 that morning, she didn't mean to look in. She did anyway. Mr. Hargrove's eyes met hers. 2, he said simply. She opened her mouth, then closed it again. You don't know that she was done, he cut in. Her body was already packing up. Most people just don't like to admit it until the machines say it for them. You make it sound like a schedule, Jenna said. Like there's a list somewhere. He held her gaze for a beat. You work here long enough, he said quietly. You start to feel like there is. After that, ignoring him felt dishonest. When he spoke, she listened, even if she pretended not to. She noticed how he picked up on tiny details. The way 110's ankles stayed puffy no matter how many diuretics she took. The slight delay before 103 answered simple questions. The new, faint rattle in 119's chest that hadn't been there last week. He never said, she'll die on Tuesday. He never gave dates, just direction. Downhill, he'd say, or not this week, but soon, or more rarely, she's not going anywhere yet. Save your worrying. Sometimes he was wrong. A resident he'd called steady ended up in the hospital with sudden sepsis and never came back. Another one he'd quietly flagged as not long hung on for months, outliving 2 roommates. But when he was right early. Before the oxygen was increased. Before the labs turned ugly. Before families were called just in case. Jenna started to hate that, because once you heard him say it, it was impossible not to watch for it. One night, about a week after Mrs. Price died, Jenna came on shift and saw something on the whiteboard that made her stomach clench. Next to room 119, someone had drawn a tiny hourglass in dry erase marker. Nurse humor. Dark, lazy, half mean. She wiped it off with the side of her hand before anyone else could see it. When she went down the hall, 119's door was open. The resident, Mr. Kellerman, was awake, watching some game show rerun on mute. He waved when she walked by. Still here, she thought. Still talking. Still breathing on his own. When she reached 118, Hargrove was waiting. 3, he said. Jenna stopped. 3 what? She asked, even though she already knew. You asked me why I was telling you, he said. You'll lose 1 before your weekend. You've lost 2. You're not done yet. How do you even know I have a weekend off? She asked, grasping at anything else. He tilted his head toward the hall. I hear you talking to the aides, he said. I hear you say you're finally off Friday and Saturday. I pay attention. That's all this is. Attention. He looked past her, toward 119's door. You should too, he added. He's giving away his stuff. People do that, Jenna said. They get sentimental. They do it differently when they think it's temporary, Hargrove replied. This one's making it permanent. Jenna walked away, heart unsteady. She told herself it was coincidence. She told herself he was just a bored old man with too much time and too many observations. But as she passed 119 again and heard the resident telling an aide, You take the radio. I won't be needing it." She felt something sink inside her. She didn't know yet if Hargrove was seeing fate, or just seeing what everyone else refused to look at until it was too late. Mr. Kellerman in 119 wasn't supposed to die that week. That was the problem. On paper, he was stable with chronic issues. Weak, yes. On oxygen at night, yes. Confused sometimes, but not on anybody's short list. Still, once Hargrove said 3, Jenna couldn't stop watching him. She noticed things she hadn't paid attention to before. How long it took him to catch his breath after laughing at a joke on TV. How often he pushed his dinner tray away without really eating. How he kept telling staff, "Take it, I won't need it," anytime someone complimented something he owned. One night, she walked in to find him carefully folding his favorite sweater. "Getting ready for laundry?" she asked. He shook his head. "No," he said. "I want my son to have it. I told him to pick it up this weekend." "Planning ahead," she said lightly. "Not planning," he answered. "Accepting." The way he said it made her throat tighten. On her 2 a.m. rounds, Jenna forced herself not to cut down the hall toward 118. She failed. She slowed as she passed his door. "Still 3, Hargrove said, without her even stepping inside. "You don't know that," she said. "He's talking, he's sitting up. His vitals are fine." Hargrove's eyes stayed on the ceiling. "Do you know how many people I've watched die with fine vitals an hour before?" he asked. "Machines are always a little behind." "You're scaring the new staff," Jenna said. "You asked me why I could tell," he replied. "This is the answer. You start feeling the end of people before it shows up in numbers. In the way they talk, in what they give away, in the way the aides walk out of the room and don't quite meet your eyes." She didn't want him to be right. Not this time. The next night, she came in early and checked 119 first. He was in his recliner, dozing, TV on some late-night show. On the bedside tray, a neat stack of labeled envelopes sat in a row. "What's all this?" she asked. "Letters," he said, eyes still closed. "Doing my paperwork so nobody else has to." "Paperwork for what?" "For being done," he said simply. He opened his eyes, looked at her, and smiled. "You're a good one," he added. "You talk to us like we're still here. That matters." "Mr. Kellerman, you are still here," she said. He just patted her hand. "For now," he said. "He died at 5:10 a.m. No code, no alarms, just a quiet, sudden stillness that the aide noticed when she walked in for morning vitals." Jenna stood by the bed while they confirmed, the clock ticking loudly in the silence. 3, she heard, before she even turned around. Hargrove was in his doorway watching from down the hall. He hadn't moved from his bed, but he'd angled his head just enough to see. "Stop it," Jenna snapped, more sharply than she meant to. "You don't know everything." His expression didn't change. "No," he agreed. "I don't." He paused. "But I'm not guessing either." After that, it stopped feeling like dark humor and started feeling like being trapped next to a weather radar that only predicted storms. Jenna found herself checking his room before she checked half her assignment, just to see how he was looking at the hall. If he seemed relaxed, she breathed a little easier. If he seemed focused, eyes tracking, attention locked on one door, her stomach dropped. Once, when a new admit arrived on a stretcher, he watched the orderlies wheel the bed past. "How long do you think she has?" Jenna asked, trying to sound casual. "Depends," he said, "on whether they keep her in 111. "What's wrong with 111? She asked. "Nothing," he said. "Yet." That word hung in her head all night. One evening on report, the day nurse lowered her voice. "By the way," she said, "if Hargrove starts in on his death predictions with you, don't let him get to you. He's been like this for months. Creeps new aides out all the time." "So everyone knows he does that?" Jenna asked. "Oh yeah," the nurse said. "He told one CNA last fall. You won't be turning Mr. Collins much longer." Collins died 3 days later. Then he pointed at another resident and said, "Her hands look like mine did last time I was admitted. Watch her." Sure enough, she was gone within a week. And no one thought that was weird? Jenna asked. The nurse shrugged. It's a nursing home, she said. Everything's weird. He's old, he's seen a lot of people go. You notice the ones he's right about. You forget the ones he's not. That was exactly what Jenna was afraid of. Because once you started counting, it was hard to stop. And the part that scared her most wasn't that he was sometimes wrong. It was how early he seemed to know when he was right. After Mr. Kellerman, Jenna tried to put distance between herself and Hargrove's predictions. It didn't work. Every time she heard a new cough, saw a new bruise, noticed a resident getting quieter than usual, she could feel his eyes on her from 118, like a second charting system silently logging what she refused to write. One slow night, around 3 a.m., she found herself outside his door with no real reason to be there. He was awake, of course. He always was. You're making the aides nervous, she said, leaning in the doorway. They're already nervous, he replied. All I do is say the thing out loud. Maybe stop, she said. Let the doctors be the ones to decide who's dying. He huffed softly. Doctors decide what they write, he said. Bodies decide the rest. She stepped inside, lowered his head of bed a little, adjusted his oxygen. Why tell me? She asked quietly. Why not just keep it to yourself? You know what it does to people when you're right. He was quiet for a moment. Because you're still paying attention, he said. Most people here stopped a long time ago. They go through the motions. You still look like you care what happens when you walk out of their rooms. That's my job, she said. That's the part that makes you vulnerable, he said. This place eats that first. She didn't answer. A week later, the nurse manager pulled her aside. Hey, she said in a low voice. Little heads up about 118. Jenna's chest tightened. What about him? Some of the staff are saying he's freaking them out, the manager said. All the death talk. This one won't last. That kind of thing. Look, you've got good rapport with him. Try redirecting him when he starts. Change the subject. Don't feed into it. So we're pretending he doesn't notice what we all see? Jenna asked. We're keeping morale up, the manager replied. And we're protecting families. Last thing I need is him telling someone's daughter at visiting hours. You know, she won't see Sunday. She had a point. Still, for the rest of the night, Jenna felt like she was being asked to look away from an oncoming car. A few shifts later, during rounds, she hesitated outside 118 and considered just walking past. Instead, she went in. Evening, she said, brisk, professional. Any pain? Any trouble breathing? Anything unusual? He watched her for a long second. Unusual? He repeated. No, just the same slow slide. You're not making comments about other residents tonight, she said, forcing a lighter tone. Must be a nice change. Not for you, he said. She frowned. What's that supposed to mean? He studied her face in a way that made her want to step back. You look tired, he said. Past normal night shift tired. You're moving like someone who's counting down nights, not hours. I'm fine, she said automatically. You stopped eating on shift, he said. You drink coffee in the break room and stare at the wall instead of talking. You flinch when someone says code, even if it's not on your side. You avoid rooms with family in them. He lifted a frail hand. You're starting to look like the ones who leave without meaning to, he said. I'm not a resident, she snapped. This isn't about me. He tilted his head slightly. Isn't it? He asked. For a few days, she convinced herself he'd crossed a line. Fine, predict which residents will die. Horrible, but at least on topic. Turning that gaze on her felt like a violation. She avoided him more aggressively, sent aides for small things, kept her own interactions as short and clinical as possible. Vitals, meds. She started picking up extra shifts on other wings when she could. Rehab, short term, anywhere that didn't have 118 on the board. It helped, a little, until the night she was floated back to East after a gap of almost 2 weeks. She checked the assignment board and felt her stomach sink. 118 Hargrove, still there, still on her list. He looked smaller when she walked in. Same room, same lamp, same hum of the oxygen concentrator. But his body seemed to have deflated, skin looser over bone, eyes sunk deeper into his skull. "You disappeared," he rasped. "Got floated," she said. "Other wings needed coverage." "Or you did," he said. "For a while." She ignored that. "How are you feeling?" she asked. "Any new pain? Any changes? Dizziness? Chest tightness?" He cut her off with a small, impatient gesture. "You've got 2 on your list tonight who won't see Monday," he said. "I thought you'd want to know." She clenched her jaw. "Stop," she said. "Don't." He watched her. "I can stop telling you," he said. "I can't stop seeing it." "Then keep it to yourself," she said. "Why?" he asked. "So you can be surprised at 6 a.m.? So you can tell yourself no one could have known?" She took a breath, held it, let it out. "You think knowing changes anything?" she asked. "You think if you say, 'That one is going to die soon,' I can stop it?" He gave a tiny, humorless smile. "Sometimes knowing is the only thing you get," he said. "You can't always fix it, but you can at least be honest about what's coming." Jenna finished his assessment in silence. As she reached the door, he spoke again. "I was never this blunt with the new grads in the hospital," he said. "Didn't want to break them. Funny how I don't have that filter anymore." "Maybe you should get it back," she said. "Maybe you should get one," he replied, "before this place burns it out of you." He crashed 3 nights later. Not one of the ones he'd pointed at. Not part of a numbered list. Just himself. The aide found him at 3:40 a.m., breathing fast, clutching at his chest. Jenna was in the room within seconds, calling the on-call, putting oxygen up, checking pulses that felt like they were misfiring. He was still fully awake, eyes locked on hers. "Well," he said between breaths, "I guess I'm finally on my own list." "Don't talk," she said. "Focus on breathing." "Funny thing," he said, ignoring her. "I spent so long watching other people's exits, I almost forgot. I had one coming too." His monitor numbers slid into a pattern she knew too well. She felt the old training kick in. Positioning, meds, calls, documentation, but underneath that, something else. A sharp, unexpected grief. Not because he was dying, because, for the first time since she'd met him, he hadn't warned her first. "Any last predictions?" she asked, the words out before she could stop them. He looked at her for a long, steady second. "Just one," he whispered. She leaned closer without meaning to. "You're going to leave," he said. "I go home at 7, she said, trying for levity. He shook his head weakly. "Not the building," he said. "The work, this wing, this job. You're still watching. People who keep watching don't last here. One way or another, they leave." His hand tightened briefly around her wrist. "Do it before your body makes the choice for you," he added. "That's the only pattern I care about now." The line on his monitor stuttered, then flattened. Jenna called the time. He went like so many of her residents did. With no dramatic code, no shouting, just a body finally deciding it was done. The doctor called it natural causes. The chart called it expected, decline consistent with disease process. No one wrote spent months reading the hallway like an ECG strip of death on his problem list. At report, day shift shrugged. "Honestly, surprised he lasted this long," someone said. He'd been on the edge for months. That night, when Jenna walked past 118 and saw the bed stripped, the room half emptied, she felt something unclench and something else twist all at once. The quiet in that doorway felt heavier than the quiet in any room with a body in it. She didn't quit the next day, or the next month, but she started looking at job postings on her phone in the break room instead of doom-scrolling social media. Started catching herself staring at the exit door during report. Started noticing how many staff looked the way Hargrove said she would if she stayed too long. 6 months after his death, she transferred to a different facility, same company, different building. New hallways, new smells, new names. On her last night in the East Wing, She took one slow walk down the corridor at 3 a.m. The doors were closed. TVs glowed. Residents breathed their thin, uncertain breaths. She paused outside 118 one last time. The room was occupied again now. New name on the board. New family photos on the wall. New old person lying in the same bed. She stood there long enough that an aide passing by said, "You okay?" "Yeah," Jenna said. "Just saying goodbye to someone who isn't here anymore." The aide nodded like she understood. "Lot of that in this place," she said. On her way out, Jenna caught a glimpse of herself in a darkened window. Tired eyes, slumped shoulders, badge clipped to a frayed scrub top. For a second, she imagined Hargrove next to her reflection, tilting his head, assessing her like another vital sign. "You're going to leave." She did. But even in the new building, on a different night shift with different rooms and different residents, there were moments when she'd walk past a half-open door, see a certain look on someone's face, and feel that old, cold recognition rise up. Not because she was psychic, because once someone teaches you how to see the pattern, you can never quite unsee who looks like they're not going to make it to breakfast.